Talgat, thank you for joining today. You and I first met in 2013 when I started my Peace Corps volunteer service. You were my counterpart in the Monitoring and Evaluation Department at the National AIDS Center in Kyrgyzstan. We met just months after I finished my Master of Public Health and right after my Peace Corps crash course in Russian language and Kyrgyz culture. Кто бы мог подумать, что больше чем через 10 лет я буду свободно говорить по-русски и брать у вас интервью уже как профессор общественного здравоохранения для своих студентов. Your career path reflects a deep commitment to advancing HIV programs and strengthening health systems across Central Asia. After graduating from the medical academy as a pediatrician, you completed postgraduate practice as a general surgeon and then worked on an ambulance as a pediatrician before joining the National AIDS Center in Kyrgyzstan under the Ministry of Health, where you eventually led the whole monitoring and evaluation department. From there, you worked with PSI on the HIV flagship project, and since 2020, you've been with FHI 360 on the EPIC project, expanding your portfolio to also include global health security. Today, you serve as Regional Strategic Information Advisor for Kazakhstan, Kyrgyzstan, and Tajikistan. Across these roles, you've consistently emphasized data-driven decision-making, monitoring and evaluation, and translating evidence into stronger HIV program and health security responses. I'm excited to talk to you today and learn more about your journey and your perspectives.
Thank you, Larissa.
Thank
Thank you
you.
for inviting me.
Thank you, Talgat. So my first question for you today, how did your early work at the National AIDS Center in Kyrgyzstan shape your understanding of HIV program implementation and the importance of monitoring and evaluation?
Yes, thank you, Larissa. So this was like very long ago, and when I was invited to join the monitoring and evaluation department, the first thing I noticed was that the organization didn't have like mechanisms for obtaining information from their own internal departments. So like each piece of information had to be requested separately from each department, and sometimes even from each individual employee, which wasn't entirely convenient. So like step by step, we have established the process for receiving information from departments on a monthly basis and created a single consolidated document, which included trends by year, gender, age, key populations, ART, and other factors. And what was important, this document was accessible for all our partners on our website. And this was extremely helpful for people making decisions within our organization and also the Ministry of Health, and also for partners, national partners from international organizations, because they usually were requesting this information from us, and before we created this document, they were asking for each employee for some piece of information. So this was very helpful. We have also did the work on the duplication of the indicators in the country, which we have reported to the Ministry of Health and different international organizations such as Global Fund, UNAIDS, and others. We were also involved in, for example, in various studies on identifying people living with HIV, key population, and biobehavioral surveillance studies. And I believe HIV programs are incredibly important because they help millions of people around the world, including in Kyrgyzstan. And monitoring and evaluation of these programs helps us understand what's making well, what we're doing well, what can be improved, what issues are being prioritized. And I've come to understand that the data we collect isn't just numbers. and as the decisions they make can improve global strategies, local legislations, and approaches to work with clients and patients, which we were doing like in practice on our work.
Mm. Yeah, you have so much experience. Thank you. My next question, my next question for you is about your next phase of work. During your time with PSI's HIV flagship project, what approaches to data use or program design stood out as particularly effective in strengthening HIV prevention and care?
Yes, thank you. This was a very interesting period in my career, and as part of the flagship project, we have implemented many different approaches for active HIV testing, because like on a national level, it's only like a passive testing. And we were the first in the country, in Kyrgyzstan, to introduce index testing of partners of people living with HIV, both sexual and injecting. We trained our NGOs to this approach, and although they were initially skeptical for this, but we saw very good results. We were tracking how many clients were offered, how many have accepted index testing, how many contacts did they provide. Um, we also were tracking so-called fidelity rate and how many clients were tested. Sorry. And also very interesting to track the testing methods such as passive, active, and collaborative. So this is a very interesting approach, which is still being successfully implemented in the country. And also, sorry, 1 second. I'm sorry. We also began implementing an active case finding approach with selecting a location, research in the area, mapping, identifying hotspots, contacting clients and testing. This is also a very interesting approach, but it is more applicable to countries where key populations are not criminalized.
Yeah, that's a really, really important point. Yeah, for those who may be listening and don't know, and correct me, Talgat, or add if you want to, the point of index testing is when an HIV tester or center encounters someone with HIV and they can offer them the ART or necessary medicines and treatment, counseling, etc. They do index testing, as in following up with their partners so they can offer other people who might also have HIV those services, even if they themselves didn't come into the clinic.
That is correct.
Yeah. Thank you.
Sorry.
That's okay. So the next question, how did adding global health security to your portfolio broaden your perspective on public health beyond HIV?
So following the COVID-19 pandemic, like we saw that weak points in the supply chain have been identified in almost every country. And this new global health strategy, which we began working on as part of the project, showed us exactly where we have gaps, I mean, within our country, and how they can be overcome, what specialists are needed for this and more. This is a very interesting area, and while much has already been studied on HIV with numerous recommendations, guidelines, studies, and analysis, whatever, this area is not so straightforward. Several documents like standards, SOPs, and orders are currently being developed by specialists from various ministries to address these gaps. And I find a lot of new and interesting in this area. The only thing is like that there aren't many standard indicators or descriptions for collecting them in field of global health security right now. And like many people, they use like more custom indicators to track this data. And our team also, we are working with help of our headquarters. We're working to standardize this.
Yeah, you bring up a lot of points that we discuss in my global health class about having metrics to measure things. And so when things aren't standardized and different organizations or institutions are using custom metrics, then it also makes it hard to compare.
Yes.
So yeah, that's interesting. Next question for you. How do you ensure that data collected in HIV programs actually informs program improvements and policy changes rather than just fulfilling reporting requirements?
Yeah, that is a good question. For our part, like in addition to reporting requirements, we also prepare a part with analytics and highlight trends we see. For example, we show which regions are better at identifying, for example, HIV, which populations, or we conduct gender and age analysis and recommend expanding testing to older ages in certain regions or NGOs. And these recommendations in our organization, they are like being implemented at the regional level. I'm not sure about the global level of our organization, but at regional, they are usually being implemented, and our recommendations are being used.
You see them being used.
Excuse me?
You see the recommendations being implemented.
Uh, yes, we
That's good.
usually discuss this before the reporting with the program team, then with the broader people like directors. We show them this dashboards, like explain our point of view, and also we are writing this recommendation to our headquarters and to our donors, so they see what we came up to with our analysis, and we're starting to address this recommendation starting like next quarter. So
Mm.
yes, usually we address our recommendations.
A lot of what I'm hearing you say now and to some of the earlier questions is to me makes me think of transparency. It seems like there's like an effort towards transparency in the system, so people are kind of aware and on the same page. So that sounds really good.
Yes.
In your current role, next question, in your current role, you work at the interface of donor priorities, national systems, and regional coordination. How do you balance these different demands while keeping programs focused on local needs?
Um, so I work with excellent team in 3 countries who help me implement our work on the ground. Like we hold frequent calls to discuss current or urgent issues, and we always, in our organization, we always treat our national partners with respect and maintain good working relationships. We always listen to our partners' requests and ensure that our project implementation is as responsive as possible to national partners and donors.
Mm.
We regularly hold meetings with national partners and exchange data with national partners, and our activities are completely transparent. Even our partners know that our work is very helpful to them. So just a few examples, like we we are helping national aid centers to test people and to bring PLHIV to the aid centers, like to keep them adherent to HIV to ART. Sorry.
Mm-hmm. Yeah, thanks.
Yes.
Next question. From your perspective, what role do partnerships between NGOs, governments, and donors play in scaling HIV and health security innovations in Central Asia?
I believe we are all working at the same goal and to help people be healthy. And each partner works with their area of expertise. So, like NGOs, they help government agencies access hard to reach population, test them, initiate treatment, support adherence, and achieve a undetectable viral load. They also help implement best international global practices in the country, and donors support the purchase of test kits, ART, PrEP, although like recent years in Kyrgyzstan, the government has taken most of the procurement itself. And together, all of us, national partners, donors, NGOs, we support our national partners.
Hmm. I think I'm going to quote you on that later. What did you say? Our goal is to help people be healthy.
Yeah.
Yeah, I feel like that needs to be, we need to like say that more often because unfortunately, I've seen in my work that HIV can have stigma associated with it. So can other diseases. Other diseases don't have stigmas. And at the end of the day, all the point of all of these programs is just to help people be healthy. So I feel like that needs to come more to the forefront of all of this and just remind people that's the goal. That's great.
Yeah, I agree.
Next question. Many countries struggle with sustainability once donor projects phase out. What lessons have you learned about building systems that last beyond project cycles?
Yes, you're right. And I believe that everything that's been developed through donor projects should be coordinated, developed, and approved jointly by national partners. This should give them a sense of ownership for these products. And I think all developments should be transferred to national partners to levels where they can be institutionalized. Institu is
Institutionalized.
Yes, thank you.
Yes.
Yeah, I just have like one example, a
Hmm.
small example. In previous project, we had developed a database, MIS database. It was very user-friendly. Everyone liked it. Once we even shared it with the Republican Aid Center. But when the project finished, the developers of this database, they got another job. So this was only the one person who was developing this database and knew the codes for this database. And this I think this is not okay, because um, when one person is holding like all the keys to the database is not right. And I like in this project we are using the open source database. So like even if our organization will leave the country, or I don't know what will happen, everyone in the IT community who knows this code can easily continue to work with this database. If
Hmm.
it's interesting, it's called DHS2.
Yes. Yes. Thank you for sharing that. I think I will add that to my class because we talk about some databases and metrics like IHME and others. So I'm going to add that one. Um,
Okay.
yeah. So much of what you're saying has so much value, especially now in a world with a lot of ambiguity around financing and shifts. So I've always thought in my own experience in global health that the more local involvement, like you said, national like buy-in, the better. And I feel like that's something that can be missed in like the field of global health when there's like external donors or external parties who do a lot, and then the people who are supposed to run the
Yeah.
programs and live the programs on are not at the forefront. So yes. Okay. And the
Yes.
last question I have for you today, um, what skills are most important for the next generation of public health leaders, or just people interested in making an impact in the health of their world?
I think that first of all, um, the person should have practical experience in the field, knowing the situation on the ground, because I have met some specialists which are preparing recommendations like on a global level, but they have never been on the field, so they like cannot. In my opinion, they cannot recommend like as much as the person with experience in the field would recommend. And sometimes we discuss that, sometimes we even argue, but like this is the issue. And also, I think that the person should have at least analytical skills, maybe forecasting ability for nearest future, like 1 or 2 years. That would be very good. And just a willingness to work in this field. Yeah, I think that's important.
Yes. Yeah, that speaks to our discussion or your response to the last question about people who are involved in global health programs, but who are actually distant from them, making decisions about
Yeah.
somewhere they've never been. Definitely something to be aware of in global health and to hopefully not continue being part of for people who get into this field. But also all of these technical skills are so important and increasingly important maybe in like a contemporary world with more and more technology that we can use to help forecast, to help try to solve issues.
Yeah, I agree, Larissa.
Okay, well, we've come to the end of our questions. So thank you so much for your time. This was invaluable, and I'm really looking forward to sharing it and spreading this information, your perspective, and especially the perspective from Kyrgyzstan, a place I love
Thank
so much.
thank you for the invitation, and good luck to all of your students.
Thank you so much.
Thank you.
Okay. Okay, I